reliable evidence. The AstraZeneca vaccines, they're safe. They're safe and they have been approved for use. And the other vaccines also, there are a lot of vaccines. Now, again, a lot of things have been said about the AstraZeneca. For example, its association with blood clots. We have seen events in which at least some people have died after they've taken the vaccine. Now, the question is there a direct cause and effect between the use of vaccine and the death? So far, like I said, the evidence given, confirmed by independent the investigation, is not related. And we can understand this. For example, in the UK, they have used it on 17 million people. Now, 17 million people, I was explaining to one of my colleagues, 17 million people, and then they have something like 19 clots. Out of the population of 17 million people, how many of those people are actually having clots that we don't know? How many of those people will you give the vaccine today and they die tomorrow? How many of that, for example, a pregnant woman receive the vaccine today and tomorrow has a spontaneous abortion? In 17 million people, you can actually have these things happening. So for the vaccine to be declared unsafe, there has to be a direct relationship between vaccine uptake and then the result. And so far, from the reliable data we are getting from the WHO, there is no cause and effect. And then, like medically, you know that, and it's quite used in medicine. What we say is cause and effect and benefit at risk. So they're saying benefit is of all the vaccines available, the benefits are more. Getting vaccinated far outweighs not getting vaccinated. And this is why recently WHO experts and even the CDC experts say, irrespective of which vaccine you have, once the vaccines are approved, get whatever vaccine you have. So whichever vaccine is available, take it and
Sorry, Doctor,
then
let me kindly remind the rest of the people to mute their mics, please. Please check your mic. If it is on, kindly mute it for us, please. Thank you. Doctor, you may continue.
Yes, like I was saying, from the evidence we have, from evidence that's shared by WHO and these companies, is that the vaccines are safe and then they can be used. And then from all the WHO experts we have so far, they say whatever vaccine you have, once it is approved by ethical committees, when it's approved by the necessary medical institutions in the world, you should use. Because at the end of the day, the safety, the benefit far outweigh the risk of the vaccines. And of course, there has to be a constant vigilance. That is government association, government institutions, responsible public health to continue to monitor what is happening with regards to the usage of these vaccines. I would encourage people to use it. But again, like I said, taking vaccine is completely optional. People are given the choice and given the risk and benefit. And weighing the risk and benefits, people should be available on their own, choose what they want to do, but they should be aware that there are a lot of misinformation out there which is not necessarily true. And like I said, with new things will be discovered along the way, and complications will arise. And this is science. Knowledge comes every day. New things are discovered and opinions are shared. And this is why WHO is advising all pharmaceuticals to be transparent. Once there's complete transparency, things will come and like as the virus adapts, people should also adapt and things should continue. So I think they're safe, and this is relying on the evidence and opinion of experts, and not just from hearsay from just any Tom, Dick, and Harry out on social media.
That's true. Dr. Mohammed Tikani, thank you for your contribution. He said blood clotting issue can be outlet and which is minimal. And he also commented on the vaccine hesitancy as it has a long history tied to racial injustice related to a decades-old study done on Black US. Thank you, Dr. Tikani, for your contribution on the vaccine issue.
Yes, just to add on to that, thank you, Dr. Tex, for the contribution. Yes, of course, this is hesitancy in the United States, for example, and we know, I think the particular event he's talking about is the Tesconi investigation or research in which some experiment was done on Black people and to see the natural flow of syphilis, and in which people were told they're receiving treatment for syphilis, but the aim of the study was to see how natural syphilis will continue without treatment. And that test unfortunately continued for 40 years, and the people were Black people, and this continued until in the 70s, when syphilis could have been treated just by a single shot of penicillin then. And so mostly in the United States, this is one of the reasons, because this test was sanctioned by the United States government. And so when it was broken out, when the information came out, a lot of Black people to date are hesitant, because they have actually a direct reason. Again, like I said, there are facts relating government's role in experimenting on Black people, and that has caused vaccine hesitancy. And it's only recently, when Bill Clinton became president, that they actually acknowledge and apologize for this rule. And so we can see the reason why there is hesitancy. So there is the political, there is lack of trust for science, and there is a lot of misinformation. This thing together would actually explain why people are hesitant. But like I said, if they are going to relate to science, it's important once in a while that data are given, and then the complete transparency, especially from the WHO and from the big pharmaceuticals. Once transparency is not there, then that will increase to vaccine hesitancy. Yes, please.
Yes, that's clear. Right now in the Gambia, over 6,000 people have been vaccinated, and I personally made my little research because I've been checking to see whether those that have been vaccinated, do we have any that have actually gotten any side effects from the vaccine after receiving their first shot. Most of them were our health personnel. As we all know, they are the first, after the president and some of our people, our senior citizens being administered the vaccine. Since the launch of the vaccine, they are the first people to receive the vaccination. After my little research, I just found out that none of them has actually gotten serious side effects. Most of the side effects they complain about is the soreness of the injection site, or little fever or headache they have. Doctor, what is your advice to our fellow citizens if the vaccine is readily available? As we all know, we have only 46,000 shots to be given to the general populace, which is not even enough for our people. They are trying to prioritize people that should be getting the vaccine as at now. What is your advice to the general populace to be vaccinated if the vaccine is readily available for the entire population?
Yes, thank you for that. I think here is important. The Ministry of Health just on Friday or on Thursday, we had a Zoom meeting in which the Director of Health Services plus the task force on COVID-19 in the Gambia. They gave interesting figures. It seemed in the western region, Greater Banjul area and western region, people are readily going for the vaccination. And there the numbers are very, very high. That is encouraging. But if you go to the interior in the CRR, in the Upper River Division CRR, people are not doing that. The number of people who are coming forward are not enough. And this could be, again, because of not enough sensitization. We have a problem with sensitization in the Gambia. People do not get adequately sensitized, and there's no enough information given. For example, we have seen the human papillomavirus vaccine and how it was received when parents were going to school and saying that their daughters will not be vaccinated. This is recently, 3 weeks ago. And this is all because of lack of proper and adequate sensitization. So whatever the case, the Health Education Union, they're doing their best. They're trying to reach the people. But how do you reach a people who do not have radios and TVs, or they don't listen to them regularly? How do you reach? You have to go to the community and try to talk to them. And how do you reach a people who are out for their daily livelihoods because COVID is causing a problem? You want to call them for a meeting. They want to go and see if they can get a little thing for the pass of the day. How do you get to them? So this is a problem, and this will continue to be a problem. So what we need to do, the ministry have given some guidelines and some priority group: the frontline health workers, the armed forces, and then the elderly, 65 above with comorbidities. And again, this will almost always be concentrated on the general Combo region. This is where we have our hypertension clinics. This is where we have our people coming for diabetic management and others. So our priority now should be to reach all the people that we can reach, and anybody who qualifies should be encouraged to take the vaccine. And hesitancy will be there. People will be hesitant, and that one we need to understand that will continue. And then we have to advise on responsible behavior from health workers, from frontline workers, from people at the airport, and then adequate border closure and surveillance. I mean, the Gambia population, for the figures we have now, frankly, it's not very, very worrying. I mean, the numbers we have, if they are reliable, we must always add that. Like one of the directors said, he said we have to actually continue doing studies on the people who are dying in the communities. So then deaths in the communities need to be investigated and tested. But again, somebody dies and then 2 hours later is buried.
That's the problem.
So these are the problems that will continue. But I think what we are getting from the COVAX scheme, 20% of the Gambian population, this is very, very insignificant. Like they say, they advise for us to get that herd immunity from vaccination, we need to get to 60% and more than that, 70%, and then we are getting 20 for free, probably another 20 more we are going to buy. 40% is still not enough. It's still not enough. So to make up for that gap, we need to do change of attitude. We need to serve responsible political leadership. Responsible political leadership needs to be on the forefront. And then the borders, we need to be careful, because the point the WHO is teaching now, we have to learn to live with COVID. But we have to learn to responsibly live with COVID, as opposed to, okay, I don't care, when I get it, it's okay, when I don't get it, Allah is okay. I mean, this is a fallacy that we need to overcome. But like I said, I'm encouraging everybody. I'm encouraging people who, it's an opportunity. When it gets to you, you have an opportunity. Just get the vaccine and be in touch with your health workers, and just monitor what's happening. Because like they said, the WHO said, currently the best we have against COVID is vaccination.
Exactly.
Currently, the best treatment. There's no treatment. There's no treatment so far. They're just management protocols on what to do, what not to do, and some of it has been found to be effective. But the best we have to control COVID now is vaccination. So if we are getting only 10% of our people vaccinated because the others are refusing, so we just have a 10% chance against COVID. The 90% is the risk. So I think we need to work on that. Yes.
Yes, doctor. The best we have right now is, as you said, is vaccination against COVID. So, doctor, do you think should a patient who has already recovered from COVID be vaccinated? As we all know, if you have a virus or if you have a disease, your immune system, they try to produce antibodies against that particular virus. Should they be vaccinated if vaccine is available for them?
So again, like I said, we had a meeting with the Director of Health Services on Thursday. That was a Zoom conference, and this is one of the questions he was asked. Again, the current evidence, the current science available is that even people who have been sick should be vaccinated after at least 2 months. Because they have found that the immunity induced by getting sick may last some time, and it's not an immunity that can last for longer. So it comes, it peaks, and then it goes down. So the encouragement is people who have been sick. Of course, when you are sick, you cannot be vaccinated when you are sick. That's wrong. Nobody does that. But 2 months after your recovery, your protection from the natural immunity you have gotten from getting sick starts to go down. And current guidelines encourage that after 2 months, you could actually go and get vaccinated. In some documents, again, like I said, this is new. People are learning, new information is coming, and they can change from time to time based on the evidence available. Is that they have found that, in fact, I was following the write-up about the Russian vaccine, that they have found that the vaccine can actually induce an immunity that is stronger than getting the disease itself. Wow. That the vaccine has the ability to induce a stronger response in immunity than that caused by getting sick itself. And so if you have gotten sick and recovered, definitely you can actually go for the vaccination. And remember, cases have been reported that people have gotten sick twice. They have gotten sick of COVID, they recovered, they have gotten sick. I know somebody who had actually gotten sick twice. Exactly. It's not a matter of I know somebody who's actually gotten sick twice. And so it is important, like that said. Again, once we follow the sciences, we wouldn't go wrong completely. I mean, we get it wrong with the science here and there, but at least we are following something. But like I said, hearsay, disinformation, misinformation causes a problem. But yes, the recommendation is, if you're sick and recovered, 2 months later, you can actually get a vaccine.
Okay, this is a question from one of our viewers. That is, do we have any moral responsibility to worry about giving the content of the vaccine?